Hey, so in this video I want to share the best subjective assessment physiotherapy question to ask in private practice. And asking this question has made myself, my therapist, and also all the other therapists that we mentor all over the world, it's made their lives so much easier. So in this video we're going to share the best question to ask to get absolute clarity, make your life easier. And before I reveal that, don't forget to subscribe to the video at the bottom of the page. We'll give you exclusive first access to weekly content in addition to other CPD courses absolutely free of charge, which I will share with you in a second. If you don't know me, my name is 𝗥𝗲𝗙 𝗙𝗹𝗴𝘀. I'm a professional sports physio, but I also have a private practice where we use a pro sport approach with non-sporting patients in private practice. So first things first, and I have to say this because common sense isn't so common, you have to obviously rule out red flags. Red flags are probably more important in this question, but I am presuming that you have ruled out your red flags. Okay, so any constant night pain, neurological deficits, history of trauma, anything like that. And the real key thing here is anything that doesn't make sense from a musculoskeletal point of view. So if it doesn't smell right, then please use your common sense. Okay, so now getting into the best subjective assessment question to ask. You can see this paper here, 2011 paper about patient satisfaction. So again, some of the key bits that I've highlighted here: patients with acute musculoskeletal conditions tended to report higher satisfaction than people with chronic conditions. So again, the key thing here is, our explanation is for this finding is that expectations of treatment differ between these groups. Okay, so meeting and setting patient expectations will improve satisfaction rating. So if you work in private practice, setting patient expectations, it's going to be a very important skill that you're going to need to master. Okay, so this is the formula that we look closely at, okay, in the module 1 of the mentorship, but also in terms of the overall experience for the patient. Okay, so you can see here in module 1, we focus a lot on the subjective assessment, and there's a lot of stuff that we talk about with this, but this is going to be a key formula that we're going to make sure that we get the balance right, because ultimately, if the patient is expecting something completely different to reality, i.e. what they're getting, then ultimately you're going to probably have a very unhappy person. So again, if they come in thinking they're getting one thing and they get something else, they're probably not going to be very happy. So the key thing here is to get the patient expectations on the same level of what's actually going to happen. Okay, and if we can do that, then we are giving ourselves the best possible chance of getting a happy patient. Okay, so the question is, what is the most important thing you want from today's session? Okay, so before you even go into your subjective assessment, you can get an idea of what the patient is expecting. Okay, now I'm not saying for 1 second that you have to give them exactly what they're expecting, but this is going to give you an opportunity then to see if there is going to be a mismatch in what they're expecting versus the reality. So again, people with more the chronic conditions, if they're saying, oh, I want to be out of pain today, they've had this thing for 5-10 years, is that really realistic today? Okay, so again, it's going to give you a great idea of where to start, and also how much work you have to do in getting the patient from here down to here, so that ultimately we can give the patient a great experience. Okay, so that's one of the most important things you want from today's session. Okay, so if this is making sense so far, just pop a yes in the comments below, followed by your biggest takeaways so far that you've got from this and what you are going to implement. As I said, it's very important. Information's great, but it's the ability to take that information and take action is the most important thing. So if that makes sense and you can understand clearly why you're doing this, then pop a yes in the comments below. Okay, so some other bonus questions. So you can see in the mentorship, we cover quite a few things. We go into quite a lot of detail here, and this actual module in the mentorship, it's one of the modules where people are pleasantly surprised at how much they take out of it. So again, you know, what can you teach me about the subjective assessment? But ultimately, the subjective assessment is the stepping ground. Okay, so it's the first pillar of the 8 pillars of the go-to therapist. So again, if you don't have clarity around your subjective assessment, then making sense of the objective assessment, being able to explain the findings to the patient and actually design a rehab plan that's designed for a person rather than just the symptoms, deciding where you're going to go with your hands-on treatment, and then being able to progress them to the higher levels and building resilience, it's going to be very hard without a very, very clear subjective assessment. So some other bonus questions to consider is having questions around a clear timeline of previous injuries and stressors. And again, in the mentorship, I actually have a quick body scan that we talk about there to actually elicit this, because it's amazing how quickly people forget about previous injuries. So getting a clear timeline of previous injuries can allow you to get a clear gauge of, or maybe some explanation of why the person has a pain experience now, or what may have contributed to that pain experience. And again, if you think that some of these injuries have contributed to the pain experience, then that's going to be something we're going to have to take care of in our rehabilitation program. Another question, what's the pain stopping them from doing? Okay, so some questions around that might necessarily be the question, because sometimes pain doesn't stop people from doing things. So you have to ask higher level questions than that. But having an understanding of what the pain is causing problems for, what that's going to allow us to do then is that's going to allow us to design treatment plans that's actually going to get results. So rather than just focus on strengthening the glutes and strengthening the core, we're focused on the patient and actually helping them be successful in life. And again, you're going to be able to set yourself up with your rehab programs to get wins for the patient, as opposed to just strengthening muscles. And then the final thing you need to be really clear on is where they want to get back to. So you have to ask higher level questions about what it is that they want to get back to, because ultimately we are designing a graded exposure plan from here all the way up there. So we want everything to do its job. We want it doing it at the highest level of load. So our approach here, we'll spend in the 𝗥𝗲𝗱 mentorship, we'll spend 80% of our time on building back the capacity of the body to tolerate these high levels of load, okay, and get everything doing its job. So we're not interested in just isolating muscles, we want everything doing its job. And a lot of our rehab and a lot of our 80% might actually be spent on taking things here and maybe helping show the nervous system it's safe to tolerate loads at higher loads and higher speeds of movement, or putting strategies in place for maybe some of the environments or something like that for a person maybe with persistent pain, where we think that actually it's not just the physical stressor, that there's other factors there as well. So again, it's very, very important that we get clear on that. And then we'll spend 20% of our time on the symptoms. So again, we don't throw the baby out with the bathwater. We still respect pathology, we still respect everything else, but we want to make sure that we're looking at the whole person, and ultimately design a step-by-step graded exposure plan, okay, just like this one for an upper limb, okay, where we go through undoing these motor adaptations and then just building that resilience up through a graded exposure, back to that all important question there of where it is they want to get back to. So that's where you can see these questions in the subjective assessment. They're going to be absolutely critical to set you up for success for the following pillars, because if you don't have this good questions in this pillar, you're not arming yourself for you're not putting yourself in the best position to make sense of the objective assessment. Then that's going to affect your ability to give a clear explanation to the patient. It's also going to set you up for failure when you're designing rehab plans, because you're not clear on the plan or where they want to get back to. It's going to help you be more specific with your hands-on and your rehab that you're going to do, okay? Because again, with your rehab, with your hands-on treatment, you're going to do your hands-on to get the patient to the next level, or to facilitate them to be able to do movements that they want to be able to do, okay? So again, we're not just doing hands-on for the sake of it, and we're not just going, okay, every patient that comes through the door is getting the same hands-on treatment techniques. We want to clinically reason why we're doing things and what we're trying to achieve. And that's the same with the rehab exercises. The rehab exercise simply solves a problem. Okay, it gets them to the next level of the grade exposure that helps us bridge the gap from where they are to where they want to get back to. Okay, and then we want to then ultimately help them be strong. So if you have a persistent pain patient and they don't necessarily want to go to the gym, but you need to understand the environments and the positions that they need to be strong in, okay, both physically and emotionally. And again, that's going to be an important part of the rehab program. Okay, so if this makes sense to you, if you want to know more about this approach, then feel free to head over to 𝗥𝗲𝗱 𝗙𝗹𝗴𝘀 and you can have 14 days free access to my shoulder return to play course, where I'll show you how to take a patient from the initial assessment all the way up through to the high level stuff. And we also have some questions in that manual as well to help you get even more clarity with your subjective assessment. So head over now to 𝗥𝗲𝗱 and you can pick up 14 days free access to the shoulder return to play course for this limited period of time. So head over there now, and I will see you on the next video.